Anjum Mahavri. I am the one of the team member of RG Marathon 5.0. So date of race is 13 October 2024 and the reporting timing is 4 a.m. So we'll flag off first race at around 5:30 a.m. which is 21 kilometer, and venue is Goa University ground, and we'll flag off first race at 5:30 at 21 kilometer, and then second race at around 5:45 to 6 a.m. which is 10 kilometer, and third race is a 5 kilometer which we flag off around 6:15 a.m. So around 15,000 registration already participated in this marathon, with 4,000 female runners and rest are male runners. For the winners we have a cash prizes, and for all the finishers we have a medals and certificate. This is the 5th edition of RG Marathon, and it is Goa's biggest event, supported by Government of Goa, Union Bank and all other associate sponsors. Thank you very much.
Time we have got opportunity to associate with this program of marathon to be conducted by RG Hospital, and the Union Bank of India is having widespread branch network in Goa. We are around 69 branches across Goa, and we are the 5th largest public sector bank in India, and we are providing all kind of banking services. But this is the first time we have got opportunity that being a responsible corporate citizen, we should promote the healthier atmosphere in Goa locality. Across India, we are doing many activities through CSR. In fact, Union Bank of India is having its own hockey team and always promoting the sports culture within the organization and outside the organization. Goa mein first time since we got the opportunity, that is why we thought we should contribute from our side. In fact, we are also trying to not only associate in terms of the monetary benefit, but also we will be providing other services with respect to this marathon through our branches, like distribution of kits, enrollment or other whatever way we can support the RG team here. I am Ashish Malviya. I am representing Union Bank of India. I am regional head in Goa region. So we are very proud to associate with this event. Union Bank of India as a responsible corporate citizen, not only providing all the services which is required for the development of nation through banking services, but also as a corporate citizen, we are always at forefront to support the communities, and also for the well-being and welfare of all the communities and all. In Goa, we have 69 branches. Other than banking business, we are also doing a lot of CSR activities. In recent past, last month only, we had conducted one national level quiz program for the students up to class 12, and we are happy to say that winner of Goa has also won the zonal level competition at Pune, and now they will be going to attend the national level competition at Bombay. And I hope our Goa team win there also. And every one of us know what is the benefit of marathon. It is one of the easiest form of exercise. There is no investment required. There is no equipment required. Everybody, anytime, anywhere, it can be done. And we are very happy once again to associate with the RG Hospital. We thanks for inviting us and giving us the opportunity to associate with these events. Thank you very much.
Good morning, everybody. Good morning, everybody, to my friends from RG as well as from the press. Now, this is the 5th edition of RG Marathon, and one of the things that we aim through this marathon is to promote a healthy lifestyle. Now, healthy lifestyle, specifically with marathon, we want to reduce the physical inactivity. Now, I'm saying this in context of a group of chronic diseases known as non-communicable diseases. Now, for my friends in the press, I'll explain to you in very simple language. Okay, in terms of 4, it's a simple thing. There are 4 risk factors, there are 4 effects, and there are 4 chronic diseases. What are the 4 risk factors? The first one is physical inactivity. Okay. The second one is alcohol use. The third one is smoking. And the fourth one is unhealthy diet. Okay. So break this down. 4. These are the risk factors. What do these 4 things lead to? what are the effects on the body? The first thing, okay, they lead to is weight gain. The second one is increased blood pressure. The third thing is increase in the blood sugars. And the fourth thing is increase the blood cholesterol. So these risk factors lead to these effects on the body. And all these risk factors are modifiable. It's in your hand. Smoking, alcohol, unhealthy diet, physical inactivity. What CDs or non-communicable diseases? The chronic diseases, okay? Like cardiovascular diseases, heart attack, stroke. They lead to chronic respiratory diseases, asthma, chronic kidney diseases, kidney failures. They lead to diabetes. They lead to cancers. These are the four diseases that they lead to. And as per the national data of 2018, this chronic communicable, non-communicable disease are responsible for almost 63% of the deaths in the world. And they are across the socio-economic status. The poor will have it, the rich will have it, okay, and across all ages. But mainly it is above after 30 years of age. So our aim to this is we cannot get rid of all this group of diseases just with a marathon. But it is at least a start in which one of the risk factors of physical inactivity, we can promote a healthy lifestyle. So that is our aim. Our aim is, it's a wider aim. It's not only promotion. It's not only, but our wider aim is to promote a healthy lifestyle. So I hope with this you are able to understand a simple language, how a simple running will lead to reduction in so many diseases in yourself.
Dr. Marzuk said, whatever the risk factors and all are there, but one thing he didn't say is that these risk factors should be reduced as well. He's not encouraging that people should continue drinking, smoking, and all. This is not this is going to reduce all this, but we ourselves have to make effort to reduce all the risk factors as well as continue with physical activity and marathon, which is going to reduce all the risk factors and give us a healthier lifestyle. So there are multiple reasons why this RG Marathon 5.0 is so significant. It has reached from a level of, I guess, 8,000 or something like that registrations in the first year, and now it has reached close to 15,000, which is a huge number considering how small state Goa as it is claimed all over the country. So that is a significant 15,000 in a population of 15 lakhs is something very, very huge. That's almost 0.1%, 1% of people are registered for this conference. And the great thing about this conference is this, for the marathon. Being a doctor, I attend many conferences, so I said conference. So, people not only from Goa, but all over the country have come, as far as from Assam and northeast, other northeast countries. So northeast states. So that itself is a very significant step towards the success of this marathon. This marathon is not just a run, as Dr. Marzuk said, but this is a feeling of unity. Like when I went for the first time, you can see that I am not a very physically active person being a surgeon, but going in for the first time for this marathon, it was a fantastic feeling. Kind of seeing the spirit of all the runners and the way they ran, and I was as usual behind them, and I was happy to be among the last. But still, the feeling that I completed the marathon gave me sort of a motivation that yes, I also can do it. I didn't complete 21 kilometers, definitely. First I registered for 5. But over the period of years, I have realized that I can increase my capacity to somewhere around 10 or 12. So for a healthy lifestyle, this 10 kilometers also is great. Not that everybody has to reach to the level of marathon, but reaching a 10-kilometer run or a walk is something phenomenal, and all of us should promote. And that itself leads to a good, healthy lifestyle. Other attractions is obviously the fitness icon of India, Milind Soman is coming, and he's so good that he allows all of us to run with him, and he himself is the motivational factor for this marathon. Then there are a lot of prizes as well, which I'm sure Anjum sir has not disclosed yet, but a lot of cash prizes. and Union Bank is so helpful in supporting us in this marathon, and I'm sure they will support all whoever approached them for whatever other reasons. So I would request all of you all, just as the whole country is joining us in this marathon, you also should join, be a part of it, whether it is 5, 10, 21, doesn't matter, as long as you complete each target, maybe 5 to start with, then 10 and 21. So through the media, I would like to tell all the viewers to please join this marathon and be a fitness freak in order to live a healthy lifestyle. Thank you so much.
I'm very happy that RC Hospital, where I work, also wants to associate with such kind of a public undertaking where they're trying to organize a marathon. So many marathons are organized all over the country and in Goa as well. But RG Hospital, as a hospital, is still trying to do something not just for patients who come to the hospital, but also for the people outside. Everybody needs to understand how this is going to be useful to them. And everybody means everybody, not just people who are struggling with weight or any other non-communicable disease. Physical fitness, exercise is for everybody. Exactly like if you were to think of a child and the child needs to go to school, you would not think 2 times about it. Same way, physical activity or exercise is for everybody. Is it for a person who has just been operated 2 days back? Yes, even they have to do some kind of limb movements and some kind of chest movements or some breathing exercises. Is it for somebody who's just had a heart surgery? Yes. But for each person, based on what they can do. We all need to do some exercise, and exercise can be done for everyone. As a large undertaking for many people in the public, I think asking them to go for a walk / jog or run or even take part in longer distances, trying to encourage everybody to challenge themselves. It's not about if you can run faster than your friend or your neighbor or your enemy. It's most important that you try and understand what you're able to do and how others are able to do more. And if you want to do more, then it is possible if you train. The idea behind this press conference, even just 2 weeks before the event or 1 week before the event, is that if you decide to lace up and come on that Sunday, you will find a large group of people encouraging you. If you are somebody who is already walking, then maybe for 2 minutes you might try jogging. People who have been diagnosed with diseases, which could be anybody in your village or in your family, I think you should try to ask them to come along. This is a great way to show social support. Do this with your mothers, do this with your fathers, do this with your friends who may be struggling with some things or may not be. Physical exercise is not just for your physical body, it's also for your mental calmness and for your mental health. The first time I came in a press conference here, I tried to enlist how many ways running is helpful to the body. And then I realized such a list anybody can find on the internet. It's more important that we try to pass on this message that if you are in Goa, I think you can turn up for this event. It's free of cost. You'll meet a lot of people, you might even share some ideas, but if you bring a friend along, then I think you might have an even better time than you can imagine. I wish to see you all then.
First and foremost, there are close to 40 to 50 people who are 70 plus and they are registered for as much as 21 to 42 kilometers, 21 kilometers. So just imagine 70 years plus, one of them is 79 years and he's pushing this to the limits. So none of us here is I think 70 or 70 plus, but still we should really appreciate the fact that such aged people are also part of the marathon and physically very, very, very active, and we should live up to them and so great of them. Secondly, we know year of girl child and all females are nowhere behind. Phenomenal number of females are registered already for the marathon, close to 3,000 or 4,000. Here also the numbers almost outnumber the males over here. So females are way ahead now, and the numbers itself is a proof that the females are much more forward and better off than those past and olden times.
चीज़ मेरे ध्यान में आई कि जब हम स्कूल में होते थे, थाउजेंड डॉन बॉस्को सर, हमारे सर डोमिनिक होते थे सर, तो वो लोग हफ्ते में 3 क्लासेस होते हैं हमारे फिजिकल एजुकेशन, हाफ एन आवर की क्लास होते थे, तब हम लोग हमारा फिजिकल एजुकेशन सब करते थे हम लोग। और उसके बाद में जब कॉलेज शुरू हुई 11th स्टैंडर्ड 12th स्टैंडर्ड सब कहीं ना कहीं भूल गए, physical education was out, it was all sitting on the beach, or suddenly we became adults from school. So I think somewhere down the line, and in school we always to play. Bosco had a fantastic football ground. We always to play, and as soon as we came to 11th, that time 11th was like for us, it was like college. We lost that track of physical education. Yeah, we are very big people. So I think somewhere down the line we have to remain children inside it. Continue our physical activity. I know with adulthood you get so many other responsibilities, and you tend to have no time. So I think it's a good thing. आपने जो बताया वो बहुत अच्छा suggestion है. We also have to go to schools, promote good habit, and also among the youth, because after once in the old age जब आपको हो जाते हैं diseases, तो फायदा क्या है? मतलब then it is just you just have to slow the process. But if you can prevent it, you can only prevent it at an earlier age. So I think this is a good suggestion, and next time, our tagline should be that we should have to prevent these diseases at a younger age. In short, we take control of our life. We are getting bombarded with so many WhatsApp university. It can tell you anything and everything. If there is a good point, for that they have 1,000 bad points as well. Okay, so for us, it is to choose. Best is to take control of your life, and we will absolutely, Dr. Raju, we should start promoting this in the youth as well. How he came and why he was chosen, I think that's more, that is not in our hand. But one thing about him, and most of the press people may not know, that after the marathon, जब हम उनके पास जाते हैं for a selfie, you know what he does? He tells you, please do 20 push-ups. Then only I'll take selfie with you. So to experience this, and he's a fitness freak, okay? And who's even at that age, and even his mother is a marathoner. Okay? So I mean, these are the people who are promoting healthy lifestyles.
His wife also running.
Yes, yeah, the full family, the entire family. So I mean to say that was the icon. That at any age we have to start running and use the physical activity. So I invite the press people also to come for the marathon and experience this firsthand. Yeah.
Goa University ground, and timing is 5:30 a.m. Our first race will flag off at 5:30 a.m., which is 21 kilometer. After 15 to 20 minutes, we will flag off the second race, which is a 10 kilometer, and after that, around 6:10 to 6:15, our third race, which is 5 kilometer. To just sum up the press conference, total registration till now is 15,000. Out of that, 4,000 is female, and rest are male runners. In 21 kilometer, we are having 3,000 registration. In 10 kilometer, we are having 4,000 registration. And in 5 kilometer, it is 8,000 registration. And it is Goa's biggest participated event till now. And I would like to thanks for the support of government of Goa and Union Bank once again, and all our consultant and team RG who is working behind the scenes since last 3 to 4 months. See, it is very difficult to do this kind of event by any hospital, and I'm very happy for my team. The only RG hospital staff, doctors and nursing consultant, they are the pillar of this event on a true sense. So thank you to all the team RG, Union Bank of India, Government of Goa, and all our associate sponsors, promoters, who is making this event possible. Thank you very much.
Subscribe Prudent social media channel and press bell icon for latest notifications.